Hi, my name is Michael Acevedo. Today will be performing the nasal gastric tube insertion on my client today. Um, First, I want to go ahead and make sure I have physician orders for my patient to have the nasal gastric tube to be placed. I'll go ahead and gather my equipment. I have a flashlight, a emesis basin, a cup with water and a straw, some tissue, piston syringe, a towel, my pH paper, my specimen cup, my safety pin needle, my lubricating jelly, my gloves, Sharpie, 2 types of tape, plastic and paper, along with my stethoscope to check placement. And the nasogastric tube itself. Next, I want to go ahead and perform hand hygiene, apply my gloves, go ahead and introduce myself to my patient. Hi, Mr. James. I will be your nurse today. My name is Michael. Can you please tell me your name and date of birth? Thank you. Verify the patient by 2 identifiers. Go ahead and explain the procedure I will be doing for you today. I will be going ahead and inserting a nasal gastric tube into your nostrils that will reach into your stomach to help give you some nutrition. Okay. I'm gonna go ahead and raise your head in the bed. Is that okay? Perfect, thank you. I'm gonna go ahead and ask you to, and then I'm gonna go ahead and provide privacy. I'm gonna close the door if also if needed. And then I'm gonna go ahead now and assess patient's nares. Mr. James, I'm gonna go ahead and inspect your nostrils. I'm gonna look for any abrasions, deterioration in each of your nostrils, any deformities noted. We look good on both sides. Then I'm gonna go ahead and have you, Mr. James, breathe normally. I'm gonna feel for any airs and which nostril is more appropriate to insert the tube in. I'm going to go ahead and insert it into your right nostril, which is more patent. I'm going to go ahead and use your right nostril. I'm going to go ahead now. I'm going to go ahead and take the NG tube and measure it. Make sure I have the proper length for you, okay? So I'm gonna start from the tip of your nose to the earlobe to your xiphoid process. Look at that. 60. Okay, we're gonna go ahead and take this off. I'm actually gonna mark it out real quick. Get my marker. Mark it at 60. Perfect. Alright, so James, I'm gonna go ahead and place the towel on your chest area so it won't make a mess on you, alright? Perfect. Next, I'm going to go ahead and lubricate the tip of the tube. Perfect. And then with the natural curve of the tube, I'm gonna go ahead and insert the tube into the patient's right nostril. I'm gonna go ahead and ask the patient to hyperextend his neck. Mr. James, I'm gonna go ahead and have you hyperextend your neck. And then I'm gonna go ahead and start to insert the tube into your nostril, okay? So as we insert, okay, Mr. James, having a bit of discomfort or pain. So we'll go ahead and advance the tube. If we're met with any resistance, we want to go ahead and withdraw the tube back and then go ahead and try to advance again if needed. Once the tube has reached the oral pharynx, sometimes the patient would feel the tube in their throat and may gag or retch. If that happens, we can go ahead and pause and then ask the patient to go ahead and take some sips of water if needed. So we're going to go ahead keep on advancing the tube till we hit 60. Okay, now we're at the 60 mark. Perfect. So if the patient had gagged, we would stop and we would ask the patient to go ahead and take a sip of water. We'd go ahead and have him tilt his head forward, take some sips, keep on sipping. And if he had gagged or anything like that, we'll go ahead and, like I said, just rest and have him take sips of water to help kind of lubricate the area so the tube can go down much easier. So for this process we didn't have, it was pretty successful. Patient tolerated very well. So now I'm gonna go ahead and tape I'm gonna go ahead and check for placement by getting my piston syringe. And then with the little adapter connected right to the end. A lot of facilities have their own policy, so I would check with them what their policy is. Usually we'll just and then I'll go ahead and attach this into the tube to extract some gastric contents. Okay, we got some gastric contents. Go ahead and take this out. Go ahead and place it into the specimen cup. Then with our pH paper, we're going to go ahead and test the gastric contents. The pH should be between 1 and 5. If it's between 1 and 5, that means we're in the stomach, gastric region. So we're good. We got that done. Next, we can go ahead and also check, if needed, if we didn't have pH paper or anything like that, we can also check for placement by using our stethoscope. So go ahead and place my stethoscope on the patient's abdomen, stomach area. So all you can do is you can inject about 10 mLs of air. And then you, with your stethoscope on the abdominal area, as you insert the air, you would hear a swooshing sound. And usually we can tell with that we're in the stomach area. Now that we had everything verified and everything looks good, we'll go ahead and secure the NG tube to the patient's nose. Have my tape here. So I'm gonna place it on the bridge of the patient's nose. I've made these little slit in the tape and little legs to help wrap the tubing around. So I'm gonna take the first leg and wrap it. Mr. James, you doing okay? Perfect. And just talking to the patient while you're doing this helps bring down the anxiety of the patient as well. Perfect. All right, Mr. James. NG tube's in place, inserted, and it is anchored to your nose, okay? After all that is completed, you want to go ahead and anchor the tube to the patient's gown. For the sake of the video, I'm just going to pretend that this towel here is the patient's gown. Then we'll go ahead and place it on the patient's gown. So James, pin this tube to your gown, okay? So it stays intact. Perfect. After that's all done, you'll go ahead and, whether it's for nutrition or for gastric suction, whatever your order was for, you would go ahead and apply the tube feed or the suction apparatus to help extract the gastric contents if there was a blockage and you needed some of that removal, or of course, like I said, enteral feeding. After that, after you're all done, you'll go ahead and throw everything away. Get everything in place. And then after you're finished, perform hand hygiene, ensure the patient's in a safe, comfortable position, always raise the side rails, and always lower the bed to its lowest position. After you do that, you want to go ahead and document the procedure that you did, what measurement you measured the tube at. Ours was at 60, and then the patient's response. Patient tolerated very well, and if there was an order as well for checking placement and determining that's in the correct place, sometimes the doctors like to order the chest x-ray or abdominal x-ray to make sure that placement's in the correct place. After that, I usually thank the patient and letting me do the procedure and ask him if he has any more questions or concerns, and then go ahead and leave the room from there.